I had Pfizer first, and then Moderna. Did any of you get the AstraZeneca? Man, 2020 was a wild year. At the start of the COVID-19 pandemic, the earliest estimate for a vaccine was 18 months, but with the unprecedented efforts of scientists and governments worldwide, the feat was accomplished in less than a year. Of course, Pfizer was all the news. It took just 7 weeks for them to produce their first batch of vaccine candidates once the DNA sequence of the virus was released. But did you know that in less than half that time, a small biotechnology company in Canada had already made vaccine candidates using plants? Genetically engineered biologicals produced in plants, or biofarming as we like to call it in our lab at QUT, is an incredibly fast and easy way to create and test new protein-based medicines. It works by hijacking the bacteria that causes crown gall disease in plants. In the process of the infection, the DNA from the bacteria is actually incorporated into the DNA of the plant. So what we do is put the DNA that we want into the bacteria, infect the plant, and then suddenly those leaves become medicine-making machines. Now this part is relatively fast and easy to do, and theoretically, the only limit to the amount of medicine you can make is the number of plants you can grow, making it very scalable. But why haven't you heard of Cofifense, the plant-based COVID vaccine from Canada, or any other plant-based medicine? There have been more than 100 different proteins produced using this platform. Well, part of the answer lies with the second half of the process. While getting DNA into the plant is fast and easy, getting the protein we want out of the plant is, well, not as straightforward. You see, plants produce thousands of complex biological molecules, including sugars, fibers, and other proteins, and this makes the process of isolating our protein of interest particularly challenging. In some cases, it can account for up to 80% of the cost of producing these plant-based medicines. The chemicals and equipment are specialized and expensive, making it difficult to scale production. The whole appeal of plants is that it would only take a greenhouse to make a medicine, something you can do anywhere on the planet. But if step 2 of the process suddenly needs thousands of dollars worth of equipment just for a few milligrams of medicine a day, well, the appeal is gone. So how do we fix this? That's the problem I'm looking to tackle with my PhD research. I'm developing new techniques to purify these life-saving medicines from plants, ones that don't need any specialized chemicals or equipment and can be deployed anywhere. My goal is to make this platform as cheap and accessible as possible so that the next time the world needs medicine, plants will be ready to make it for us right away.